make these questions. No double-barreled questions and no preambles. Please put your questions together and ask directly and point it to the appropriate personality who is expected to respond. At this point, let me now invite the Secretary to Government to please come to the podium to make his remarks. Thank you.
Members of the Presidential Task Force, distinguished ladies and gentlemen, gentlemen of the press, good afternoon. I warmly again welcome you to the National Daily Press Briefing on COVID-19 for Friday, the 3rd day of April 2020. As expected, we continue to monitor the situation across the nation. We are getting positive reports that there has been a high level of compliance with the lockdown orders in Lagos, Ogun, and the Federal Capital Territory. As I mentioned in my remarks yesterday, COVID-19 remains a potential danger to all of humanity, and it threatens our economy and national security. It therefore behoves on us to play our part in the national response very seriously. The federal government has ramped up its energy with the state governments through video conferencing communication and the platform of the Governors Forum. By these measures, a lot of gaps are being closed for uniformity of purpose. The Presidential Task Force finds it very necessary to appeal to our law enforcement agencies to deploy tact and caution in the course of enforcing the rules, even in the face of provocation. We similarly appeal to all Nigerians to be law-abiding, exercise patience, and self-restraint. The message from Mr. President is that no Nigerian should, on account of these rules, suffer any harm or pains during this period or any other time in our national life. To the Nigerian traders and businessmen and women, we appeal for resistance to the urge to hike prices of goods and commodities during this period, as our compassionate nature must prevail. This is the best time to be considerate and to show empathy for our fellow countrymen. I am pleased to inform Nigerians that we made progress in the mobilization of resources to reinforce our preparedness and our implementation arrangements. In recognition of the danger to which our frontline health workers are exposed to, government is working with other stakeholders to structure medical and life insurance cover for their protection. I therefore wish to assure them of our commitment and urge them to put in their utmost best as they battle to save us from this ravaging virus. Then the role of the non-governmental organizations and civil society organizations in this battle is also well acknowledged and recognized. I, however, urge them to deploy their resources, especially community-based manpower, to shore up the arrangements by the subnational entities referring to the states. At this juncture, the following members with specific ministers will take their turns to brief you on the activities of the Presidential Task Force and, by extension, the government on our response to COVID-19 pandemic in the last 24 hours. They are the Honorable Minister of Health, the DG, Nigeria Center for Disease Control, the National Coordinator, and a couple of other ministers that would have reasons to step to the podium. I now yield the podium to the Honorable Minister of Health to give us his update for today. Thank you.
Good afternoon, everybody. The Secretary to the Government of the Federation, all ministers, directors here present, ladies and gentlemen. The global number of COVID-19 cases has crossed the 1 million mark. Barely 3 months after the outbreak was first reported in Wuhan, China. It is an indication that it is a public health challenge that we must not take lightly. Here in Nigeria, we recorded 10 new COVID-19 cases over the past 24 hours, so that cumulatively we have, 6 new cases. Cumulatively, we have 190 confirmed cases as of across 12 states and the FCT. There have been 2 fatalities and 20 cases have been discharged from hospital after successful treatment. There are 98 in Lagos State, 48 in the Federal Capital Territory, 20 in Osun, 8 in Oyo, 5 in Akwa Ibom, 4 in Edo, Kaduna, and Ogun, 3 in Bauchi, 2 each in Enugu and Ekiti, and 1 each in Rivers and Benue State. We are already seeing what may be indications of sustained community transmission, in the sense that 30% of the cases have incomplete epidemiological information, while 51 are imported cases and 19% are contacts of known cases. We're using the small window of opportunity remaining to intensify investigations to identify cases and their sources. This is one of the purposes for which the lockdown of 2 states and the Federal Capital Territory was proclaimed by the President. These areas, especially Lagos as primary epicenter, but also other parts of the Federation, will need to speed up their activities to detect and isolate COVID-19 patients. During and following the lockdown, we expect to see an increase in cases as a measure of improvement in case finding. If all the social distancing and other measures are adhered to, the incidence of positive cases can be controlled. We have tested nearly 3,000 samples so far, and we are working hard to scale up our capacity in a targeted approach. Coronavirus Treatment Center Accreditation Committee was inaugurated yesterday by the Honorable Minister of State for Health and has begun developing an accreditation checklist as well as a protocol for management of isolation centers. We are compiling a list of trained workers in the health sector to man the centers as they become operational. Directors of the Federal Ministry of Health had discussions with the Federal Ministry of Industry, Trade and Investment, and the Manufacturers Association of Nigeria to explore potentials for local production of medical consumables such as face masks, gloves, sanitizers, and even equipment like ventilators. This is in view of the looming global shortages of medical supplies for response due to high demand by all countries. Clinical trials and other processes are ongoing to validate various therapeutics for COVID-19 treatment. I have been notified of gifts of medical supplies from China, courtesy of a group of Chinese companies working here in Nigeria. A special cargo aircraft shall leave Nigeria in a few days to collect the items, which include commodities, personal protective equipment, and ventilators. Of great interest is that an 18-man team of Chinese medical experts, including doctors, nurses, and public health advisors, shall come along with the flight to assist us. I must at this juncture commend our frontline health workers who are doing a great job in case identification and management. As we prepare to contain COVID-19 outbreak, we must not lose sight of other health challenges in our country. Routine healthcare service must continue in all hospitals. Only a wing of tertiary centers need to be put to use for infected patients. I also urge all states to find more beds for isolation and treatment, and this may include renting hotels. It is important that we do not drop but continue our services, including maternal and child health and immunization. I shall communicate this to the commissioners of health of the states. I shall also instruct all federal health institutions to this effect and for them to work with state officials. Those who have to deal with coronavirus patients are, as I said, to commit only a wing of their hospitals. And to this purpose, they have all been supplied with starter packs of personal protective equipment and consumables. I want to remind you all again that all these efforts will not be effective if we do not cooperate fully with the government. We recognize that the lockdown may be difficult and inconvenient, but it is necessary for the good of us all. Thank you.
Director General, NCDC.
Chair, honorable ministers, gentlemen and ladies of the press. Just like I've done over the last few days, I'll pick up one topic and try and address it in a bit more depth. Today, we'll deal with the issue of testing. And getting more people tested is something that is being talked about globally. And you would all have been following this conversation. This is exactly what we're trying to do too, improve our capacity to test, but we must do so safely. And we must make sure that in the effort to do it quickly, we maintain the due diligence and make sure that every test that we provide to every Nigerian, when it's negative, it's negative. When it's positive, it's positive. So as much as speed is important, safety is also important. And we have to find the balance between these two. While some global bodies have advised everyone to test, the realities around the world are not the same. The world is different. The circumstances are different. And Mr. President asked us not to look east or west, but to find the right solutions for our country, considering the circumstances in our country. So, we cannot raise expectations to unrealistic limits. We keep pushing step by step to improve our testing capacity. It's not an easy process that you can switch on and off. We're not just limited by funds. We're not just limited by infrastructure, but the biggest limitation is the human resources, the people that have already been trained in molecular diagnostic testing. This is not something you can pick up volunteers up and ask them to go into the lab and start testing. It's a very complicated process, one that we are doing. The people doing this are the same people doing the actual testing. So we have to find a balance at the moment between building capacity, increasing throughput, and actually assuring testing. So we have, over the last few days, issued a case definition that has been widely circulated to the states, and are asking our colleagues across the country to adhere to this case definition, to test only those that have symptoms, respiratory symptoms plus fever, that have either returned from travel, which is now a declining proportion, those that have had contacts with cases, or for those that there's no other underlying reason for having these symptoms. This case definition might change over time as we increase our capacity, but in the short term, we need to make sure that we are focused on those that need it the most. To date, we have tested about 4,000 people, and we continue to drive up this number. We have fulfilled every requirement for a test, so there's nobody that has come forward. Sometimes there have been some delays, but every single sample that has come forward has actually been tested. Currently, we have added one more lab this morning over the last few days, so we now have 8. The reason is that now 3 labs working independently in Lagos. The Lagos University Teaching Hospital, which you knew about already, the Nigerian Institute for Medical Research, and now the Biosecurity Center in Lagos that used to work with Luth in collaboration have now completely separated. So we have now 3 labs working independently in Lagos, so we now have a total of 8. Like I said yesterday, Ibadan and Abakaliki have recently been activated. Today, we're activating a second lab in Abuja, the Defense Reference Lab, to support not only the armed forces, but everyone around that area, their families, and everyone else that can access that. And we will work with them to scale that testing. The next town that we'll be going to will be Kano. So between Sunday and Monday, we hope to activate Kano, and from there start a series of labs in the northern part of Nigeria to make sure everyone has access to the lab closest to his or her location. In addition to all of this, we have some exciting proposals that we're working through with the private sector. The private sector has really come on board to support us in doing this. Not just the private sector, some other public sector organizations that have private sector affiliations. The Nigerian Sovereign Investment Fund Authority, Nigerian Sovereign Investment Authority, is also working with us on a very interesting proposal to increase laboratory testing capacity in 3 locations in Nigeria. So there's a lot of work happening in the background to increase our testing capacity. But we need patience. We need the patience of Nigerians to walk through this in order to do it safely. The other thing we're doing is working with both the TB program and the HIV program to convert some of the technologies that they're using for TB and HIV for testing for COVID-19. This too is a conversion process, so it's not that simple, but all of them are on the way. So we really hope that by the end of next week, we will keep announcing increase in throughput in testing. But I want to remind everyone that testing alone is not going to solve this problem. There's a lot of focus on testing. There's a lot of energy going into testing, both on the global scale. There's a lot of research going on to validating the rapid diagnostic test kits that are being sold around the world. We are waiting for those results. We have to wait for them in order to offer them to Nigerians. Once they're validated, we will start offering these. But until they are validated, we cannot offer this test. So we have to wait. But we're not just waiting and keeping our hands crossed. We're waiting while we're quickly improving and increasing the capacity of our existing labs. So we continue to urge Nigerians to be patient. We will try to meet all your demands by testing through the existing labs. And as we increase our capacity, we'll open that up to a lot more people. So thank you very much.
The National Coordinator.
My brief will be quite short. I just wanted to remind the public that we will be publishing the guidance in terms of how the restrictions will work, which will also provide a protocol, particularly for the food and grocery industry. At the same time, we have continued to meet at the task force. We have been looking at issues that are arising from the states, and we will be linking up with the states tomorrow morning to have a detailed meeting. Thank you.
Thank you. We will now take the Honorable Minister of Aviation, followed by the Honorable Minister of Information and Culture.
Gentlemen of the media, good afternoon. This is just a follow-up onto the directives and protocols issued regarding crew rest, especially for flights that are in excess of 6 hours, say coming from the US. We would provide allowance for crew rest, and they would come out of the aircraft, but protocols have been developed to that effect to ensure no contamination, and those protocols will be published, and they can also be gotten from NCAA and the ministry. Regarding oil and gas exemption for flights, mostly of which are helicopters and a few fixed-wing aircraft, they will continue to do so. However, they will be restricted to only oil and gas services, as provided in the presidential address. The cargo will continue to front-load packet lists. We are happy to give in advance approvals for landing, but for each particular landing on cargo would be requiring that front loading of the lists, and also to prepare ourselves and those of Port Health to receive such flights. And this is what we have for now, and I thank you very much.
Thank you. Honorable Minister of Information and Culture.
Thank you very much. Thank you very much. I will start first with a clarification. The chairman of the task force, COVID-19, made a statement here yesterday, which I repeated elsewhere, but there's a lot of misunderstanding. And that is to the effect of how much funds has been received by the task force, COVID-19. I want to say once again, but as we speak today, we have not received any money into our account. However, the private sector is mobilizing a lot of funds, but they made it clear to us that because the procurement process in government is slightly slower than their own style, that they would welcome our request and provide us with the kits and the equipment that we may need. As a matter of fact, we have already sent the list to them. But as we speak today, what the chairman said, and which I reiterated, that we have not received any funds from anybody into our account remains valid. But this is not to discountenance the efforts of the private sector. We appreciate what they are doing, and we are very happy with what they are doing. Unfortunately, our chairman is also on the steering committee of the private sector fundraising. So we are always informed as to what is going on in both sides. Two, I want to report that the National Broadcasting Commission has given out a directive to all radio stations and television stations that they should not entertain any unverified claim as to as to vaccines or drugs or treatment for COVID-19. And anyone that does so will be fined, because right now we hear on some radio and TV stations some people who come out to confuse people and give them all kinds of solutions to COVID. They say if you do this, we do that, and I'm told that many people have been rushed to the hospital suffering from overdose of some drugs. I think the important thing is that we must always remain, we must always listen to what the Ministry of Health is saying, what the Center for this Control is saying. We are guided by WHO and other world authorities, and the task force would always remain focused. We don't want any bogus claim that will add to our problem. Lastly, I want to say that consequent upon our directive, the free TV has offered everybody on that 35 channels free viewing between the 1st of April to the 30th of May. Thank you very much.
Thank you very much. Before we go into the question and answer session, I'd like to invite the Honorable Minister of Foreign Affairs to say a few words.
Ladies and gentlemen of the press, you might have heard there have been concerns about the possibility of Nigerians who are stuck outside the country and what the government might be doing in respect of evacuating them and bringing them back. So what we have done is have sent communication to all our embassies and all our missions for them to ascertain, together with the Nigerians in the diaspora organization in those countries, if and how many Nigerians are in such situations. And as soon as we've been able to collate the numbers, we will start looking at the modalities to adopt to effect whatever evacuation may or may not be necessary. And in this context also, it's nice to be able to say that our permanent representative in Vienna, Austria, has been able to obtain from the International Atomic Energy Agency, one of the agencies of the United Nations, about 80,000 euros worth of medical equipment and supplies. Thank you very much.
Thank you very much. We are now going into the question and answer session. Please be reminded, we have to make this very compact. We have 1 hour for this press briefing, and as you approach the microphone, your question directly, no preambles, and avoid double-barreled questions. You have taken your numbers. I will now call numbers 1 to 6 to please come over.
Sir. All right, good day, sirs. My name is Femi Akonde. I'm a reporter with TVC News. Sir, DG NCDC, we keep hearing you say not everyone should be tested, only when they start showing symptoms of the COVID-19. But yet we see governors, politicians, everybody putting out their status. And you've told us again rightly that there's nothing like the COVID-19 status. Don't you think it's high time to maybe seek protection from the SGF and indeed the president from undue influence of our powerful politicians and governors who want to be tested at all costs, regardless of your testing protocols? Thank you.
Honorable Ministers, my colleagues, my name is Amaka Ode. I report for Arise News. My question is also directed to the DG and CDC. The last time you spoke about contact tracing, you said your agency was, facilitating tracing of about 5,000 contacts. I want to know where we are with that, especially as there is this lockdown. Thank you.
Good afternoon, sirs. Good afternoon, my colleagues. Rachel from News Agency of Nigeria. Sir, this for the Minister of Health. Suspected sufferers of this virus who escaped from being quarantined. The case of the official who escaped in Bauchi. I think Nigerians would like to know if there will be any punishment for such person to serve as a deterrent for other people. Now, persons with disabilities are complaining that they are not factored into government plans for the management and control of the virus at this time. I don't know if the SGF has something to do for them to address this. Now, this is for the NCDC DG. Experts emphasize that sufferers of this virus can now spread it by mainly talking to people or breathing or a healthy person close to them. I don't know if there are measures put in place for us to wear masks permanently in Nigeria, and if we've made contact to the outside world to get masks because of our population. Thank you very much.
Good afternoon, sirs. My name is Friday Okerigbe. I'm a reporter with Channels TV. I'd like to ask two questions. The first one, I will be grateful if the SGF can respond to it. It has to do with the prediction by the Food and Agriculture Organization, FOA, that following the pandemic, there's going to be a global food crisis. So what is the federal government actually doing to mitigate the effects as time goes on? Because we know that we'll overcome this. And we also know that some of our grains reserves are being depleted as we speak. What are we doing to mitigate the effects of that predicted food crisis? And my second question, I would like either the Minister of Health or the DG NCDC to respond to it. We've read reports. Yesterday, I read a particular report from France that some of the test kits that were donated to them from China were returned because they are substandards. And now we've been receiving donations from Friends of Nigeria. The minister just told us about another package that we're expecting. What quality control measures do we actually have on ground to ensure that the donations we are receiving from either internationally or within meet standards, so that we do not just accept them in the name of donations and at the end of the day complicate issues? Thank you.
Good afternoon all. Good afternoon Nigerians at home. My name is Mitaire Ikben with the NTA. Reports from our colleagues in the field and even from the FCT enforcement team indicates that the Federal Capital Territory is beginning to bubble with a lot of people in the metropolis due to the window provided by the PTF for foodstuff shopping. Has the PTF noticed this trend, and what action does the PTF intend to take in order not to defeat the overall objective? My second question is that the South African government on Wednesday this week commissioned 67 mobile testing units as cases in that country continue to rise to over 1,300. Is the mobile testing unit a viable option, and is the PTF considering it to increase testing capacity for the over 6,000 contacts being traced? Thank you.
Good afternoon, members of the Presidential Task Force on COVID-19. My name is Yemi Adebayo from AIT. I just have two questions for the PTF members this afternoon. And first has to do with, among Southwest states, I think the Honorable Minister of Health and the NCDCDG will address, among Southwest states in Nigeria, Osun State appears to be having to be recording the cases of COVID-19. The number keeps rising. There is no case we have in Nigeria today that you don't find Osun State being part of the state being affected. I want to say, don't you feel it's high time you need to raise the level of awareness among citizens in that state of how dangerous this disease is, this virus is? Then secondly, I want to ask, for those that have confirmed cases and have been treated and have been discharged, is there a follow-up like it's done in other countries, or is it that it ends there? Thank you very much.
Good afternoon, Mr. Chairman and other ministers present. My name is Nancy Anika from Region Nigeria. My first question is to the DG NCDC. You said only those with symptoms will be tested. I would like to know if some people could have the virus and not be symptomatic, what measures are we going to use to detect that if we're not testing those without symptoms? And then secondly, my question is to the minister. On the possible evacuation of Nigerian stock in outside other countries, what measures are we putting in place to make sure they are not coming to add to the number of COVID-19 cases in the country? Thank you.
Mai girma magatakardan gwamnatin tarayya wanda shine mai masaukin baki, akwai kuma kusoshin gwamnati da ke wannan wuri zaune tare da sauran 'yan aikin jarida 'yan uwana, barkamu da warhaka. Sunana Abubakar Sadiq Yaro Rawayo cikin jihar Katsina. Na fito daga gidan rediyon tarayyar Najeriya na Abuja. Ina da tambayoyi guda biyu. Tambaya ta farko shine, a shekaran jiya Laraba, ministan ma'aikatar kula da walwalar 'yan Najeriya, wato Hajiya Sa'adiya Umar Faruk, ta bayyana cewa ana ba da kudaden tallafin hana zirga-zirga ga jama'a ga al'ummomi marasa galihu da hukumar ta yi wa rijista. To tambaya a nan ita ce, waɗanda suka rasa rayukansu daga wancan lokaci zuwa yanzu, shin an maye gurabensu da sunayen wasu? Idan ba a maye ba, me yasa? Kuma wannan tallafin domin su waɗancan da aka yi rijista aka yi koko domin ɓullar wannan cuta ne yasa aka ce mutane su zauna a gidajensu, za a ba su tallafi domin ya rage masu raɗaɗin zamani a gidajensu da aka ce a yi. Tambaya ta biyu, ina ga wannan tambaye magatakardan gwamnatin tarayya kila shine zai ansa ta. Sanin kowa ne duk waɗanda suka kamu da wannan bahaguwar cuta a yankin babban birnin tarayya ana kai su asibitin koyarwa na jami'ar Abuja da ke garin Gwagwalada. To, hakan ya jefa tsoro a cikin zukatan waɗansu, inda har muka samu rahotannin cewa waɗansu marasa lafiya waɗanda su ba cutar toshewar lumfashi ta kai su ba, suna kwace ya nasu su fice su bar asibitin saboda an ce wannan cuta tana bin iska ne. Shin a matsayin ku na 'ya'yan wannan kwamiti, wani ƙoƙari kuke yi kuga cewa kun cire wannan tsoro a zukatan al'ummomin da ke wannan yanki ta hanyar wayar da kansu, musamman ma waɗanda ba su koshi da ilimin sanin ko meye cutar ba? Sai an jima.
Okay. Good afternoon, everybody. My question is this, after which I will ask in Igbo language. My name is Chinedum Chimezie, Radio Nigeria, Abuja. Our medical experts made us to understand that mosquito is the causative agent of malaria disease. Rats causes Lassa fever. White monkey, bats causes Ebola disease. Then what's the actual cause of coronavirus disease? Yesterday, we were told that 11 persons with this dreaded disease were treated and discharged from Lagos Center. Now, what is the name of the drug that was used to treat those patients? Or is it not yet time to inform the general public the name of that particular drug or drugs used. Ndị ba ekele m unu. Ndị ọka mmụta ahụike ha mere ka m dasị na ọ bụ anwụnta na-ebute ọrịa malaria, oke na-ebute ọrịa lassa fever, enwe, adaka na ụsụ ha na-ebute ọrịa ebola. Ajụ wee bụrụ olee ihe butere ọrịa a na-akpọ coronavirus. Emere ka anyị matasị na agwọla iri mmadụ abụọ bụ ndị nwere ụdị ọrịa n'ogige ebe a na-agwọ nke a dị na Lagos. Ajụ wee bụrụ olee aha ọgwụ eji wee gwọ ndị a wee sị ha lawanụ ahụ na dịrịnụ mma, ka ọ bụ oge erubeghị ịgwụ ụmụ afọ Naịjirịa niile lekwa ọgwụ eji wee gwọ ndị a ka onye ọbụla mara ya bụ ọgwụ ahụ a ga-eji gwọ. Ekele m unu, ndewonu.
Ẹ kú àsán o. Orúkọ tèmi ni Òjó Suleiman láti lè ṣẹ̀rédò Nàìjíríà. Ìbéèrè mi lọ sọ́dọ̀ mínísítà ètò ìròyìn Alhaji Lai Mohammed. Yorùbá bọ̀ wọ́n ní kókókó làrán fàdítì. Ló mú kí n béèrè pé lóòótọ́ ni iléeṣẹ́ rédíò ní ojú káàkiri orílẹ̀-èdè yìí. Ṣùgbọ́n ọ̀nà wo wá ní ìjọba ń gbà láti dájú pé àwọn tó wà ní ẹsẹ̀ kùkù lọ́hùn wọ́n mọ̀ sí tó ń lọ ní àwùjọ wa nípa kòrólà. Nídìí èyí torí pé àwa tí a wà nígboro tá a ní àǹfààní àti kàwé òun ni à ń wo tẹlifíṣàn, à ń gbọ́ rédíò. Àwọn tí ò ní rédíò gbọ́ ní ẹsẹ̀ kùkù, ọ̀nà wo ni ìjọba ń gbà torí àsáwọ̀ tó tún lè ṣe àtànkálẹ̀ àrùn láwùjọ wa. Ẹ ṣé.
Good afternoon, sirs and ma'am. My name is Juliana Taiwo of Sun Newspapers. First question is, on my way here, I had an encounter with security personnel. I have an encounter with security personnel, and it seems, again, they are working at cross purposes with what this committee stands for, the directive and all that. It's like your identification is not enough. I want to know what the committee is doing to carry them along so that once we identify ourselves, we don't have to go through these altercations. Yesterday, I got a question from somebody, and the person is asking, why are, the Minister of Foreign Affairs, please, you might want to answer this. Why are foreigners leaving the country? And they say, is there something they know that we don't know, or is it a vote of no confidence in our medical system? So you might want to reassure Nigerians or answer whatever fears they have. Thank you.
Thank you very much. We have filled the basket completely with all the questions. They have been directed at the Minister of Health, the NCDC, closely following him, the Honorable Minister of Foreign Affairs, the Honorable Minister of Humanitarian Affairs, Disaster Management and Social Development, the Honorable Minister of Information and Culture, and the SGF. We'll begin with the Honorable Minister of Health.
So good afternoon once again. I will answer the questions that come close to the Ministry of Health and invite the Director General of NCDC to add details to some of them. Now, with the question of someone who escaped from, I think, treatment in somewhere, Bauchi, I don't have information on that yet. I'm going to find out about it and I can get back to you. But if NCDC knows about it, it can say something. I have not been briefed on it, if it happened at all. Now, about the testing, we have a policy here of targeted testing, in that we believe if you are hunting, you look for what you want, target it, and get it. You don't go in the forest and start shooting left and right, hoping that you can get something. If you have enough ammunition for that and you enjoy shooting, probably it works. But the targeted testing that we do means that we identify those who are most likely to be infected, those who just came back from abroad, those who have contacts, have had contacts. But as the picture changes, we are worrying more about community transmission. The pattern has been extended to include those who have symptoms or are probably in any way connected in an area where the prevalence is high, or criteria that indicate that this person might be positive, so that you're able to utilize your resources more effectively, but generally to use your resources carefully. With regard to the Osun State, you recall that I did mention that a busload of people came in from Ivory Coast by land, where buses drive by land, and by the time they finally got in here, they were put into isolation, and it is from testing these people that we are discovering more and more cases. And that is why yesterday I advised against unnecessary travel. If you have to travel, you have a very good reason for traveling, yes. But I advise against non-essential travel, and particularly non-essential travel in crowded buses, where one person who has a virus has the opportunity to infect a large number of people. So if you are a resident in a place, it's better to stay there and follow the rules. Don't think you have to evacuate to your home. If you have just been a visitor or a tourist, or you had a casual visit, then of course you can find your way home. But we like to advise that if you can use one vehicle where you are alone with a driver, it is better for you. The fewer the people, the better. That is what underscores the recommendation for social distancing. When you are in a crowded bus, there is no social distancing, and you are more at risk. In that case, if you remain where you are resident, it doesn't have to be only in Nigeria, but in any foreign country, it's better for you. Now, yeah, those who have been discharged are traced and followed up for a period of time. And of course, they have a number to call if they have any symptoms or if they observe any problem. Evacuation of Nigerians from abroad, that is, again, related to what we are saying. I'm not sure we have received any request for that. But if there is no need for it, I don't think it should be done. If there's a request for it, then there must be a justification. And if they justify, yes, we want it, of course, they can be evacuated. The Minister of Foreign Affairs said something like that recently. So if they really feel that they need to go home, come home to Nigeria, yes. It's their country, they are free to come, but travel safely. If you are jam-packed in a bus, we believe that your chances of getting infected by someone who does not know that they are positive in a crowded bus, your chances are quite high, or a crowded truck. The drug used, that drug that was used, or the drugs that were used, are actually matters of interest to the doctors who are provided a treatment. The doctors will advise each other about which drug they used. And I believe as time goes on, they will compile a report of what worked and what didn't work. As I said earlier, the treatment centers in Lagos are using certain drugs for clinical trial, and they will be able to add from their experience to the body of knowledge on what works and what didn't work. But it is not, you may have also read recently that some people were suffering from chloroquine poisoning in Lagos because they thought, well, this is the best way for them to treat themselves. Drugs are not for people to go and purchase and treat themselves with, so I won't advise anyone looking for the name of a drug to treat himself with when you are not even sure you have that sickness. I think that's all that concerns the Ministry of Health. Thank you.
So thanks for those very good questions. Firstly, there's no testing of high-profile people going on. So we have to just clear the air on that. Earlier on, we had a slightly different case definition. We changed that case definition, and since then, everybody is adhering very strictly to that case definition. So we're not under any type of pressure to test anyone. We're doing, and everyone is following the case definition, and we have the full support of the PTF and the full support of the government of Nigeria. In terms of contact tracing, at the moment, cumulatively, we have identified about 6,700 contacts altogether. But remember, some of them have graduated out. So when you follow a contact for 14 days, he doesn't become ill. We graduate you out of the contact list. So at the moment, we've followed up on about 71% of that. That's actually the figure from yesterday. So at the end of the week, so by today, we'll do the analysis for this week and provide updated figures over the weekend. So that's really all the focus this week has been to improve our level of contact tracing. And the teams, particularly in Lagos, have really benefited from the quote-unquote lockdown. That has really enabled them to do this very difficult work. You all know how getting across Lagos is. So this has really become, it's like night and day, the difference between last week and this week in Lagos. So I know there's been a lot of pain among citizens, but please endure this for a few more days next week, and then we'll see how the situation unfolds. The question on masks, I think I answered this yesterday. We continue to review the evidence around this. If we are to make a population level announcement, we will, but we have to consider everything related to that decision. It's not an emotional decision to make. We'll look at the science, we'll look at the benefits, we'll look at the pros and cons. At the moment, our priority with masks are healthcare workers. Healthcare workers are the most at risk of getting this disease, especially those managing patients in Lagos, Abuja, and all the other centers where there are cases. So like I've said, we've distributed IPC materials to these centers. We've also distributed to every teaching hospital, FMC in Nigeria. We've also distributed to every state. If they haven't got it yet, they're going to get it during this weekend. So our priority in the short term is healthcare workers, as the evidence around population-based use of masks is further evaluated. Friday, you asked a question about equipment from China. Rest assured, we never deploy anything before we validate its use. Primarily test kits. We would never deploy a test kit until we have validated its use. So right now, that process is ongoing. We're still using, right now, the kits that we had before the donation from Jack Ma came in. That valuation is ongoing. Once we are sure that it provides answers equivalent to the test kits that we have, then we would deploy. The question on mobile testing centers in South Africa, what those centers are collection centers. And we're about to do the same in Lagos and Abuja over the next weeks. We'll launch one center in Abuja and try it out as a model, and then potentially scale up. So those centers are where you bring people together to collect the sample. The testing actually is not happening in those sites, the drive-through sites to collect the samples. Then those samples are batched and taken to the lab for testing. And that's a strategy we're looking around the feasibility of implementation in certain places in Nigeria to increase the number of tests that are being done. The question on Osun and awareness, most of the cases in Osun, yes, we've had a lot of cases, but most of them are related to one cluster. So there's a lot of effort going on at the moment to contain spread from this cluster and make sure that things don't escalate. So we're going to focus specifically on Osun. There was also a question on what we're doing with discharged patients. At the moment, we have all their data. We will follow up with them, but they're not like top of our priority right now because they're well, they've been discharged, they need to align with their families, and we need to give them some time to reconnect and be at peace, reconnect with society. But we'll follow up with all of them, make sure they're well, and potentially follow up with any research that they may agree to do with us. Yes, we are not testing asymptomatic patients at the moment. That is our policy. There are several reasons for that. We can't announce to do something until we are sure we are able to do it and do it well. So these are not emotional decisions. If we have the capability to test 100,000 people, we would announce it. But the simple truth is that we don't at the moment. We are building up our capacity, so we don't. So what we are doing is focusing on those that need it the most. And that is our strategy. So we need to focus on those that need it the most. We're not saying we won't do this in the long term. Like I said when I spoke, there are many efforts to increase testing capacity. As we do that, we may review our strategy. But at the moment, we're focusing on those that need it the most in order to make sure that we don't have too many severe outcomes. The last two questions were in Igbo. The questions related to whether there wasn't an animal vector for this disease and whether there was treatment for this disease. The answers in the first place, yes, there's no animal vector for this disease. Not every disease has an animal vector. So for this, it's passed from person to person. And in terms of treatment, there's no specific treatment for COVID-19. What we do in the hospitals is sustain their respiratory function until the patients recover on their own. So briefly in Igbo, ọrịa akpọ COVID-19 na-efe ọ na-esi n'ofu onye efe n'onye ọzọ onweghị anwụnta na-ebu ya ọwụghị oke na-ebu ya ọ na-esi na mmadụ fee n'onye ọzọ ofekwe n'onye ọzọ so ka o si efe nke ọzọ bụ maka ọgwụ enweghị ọgwụ eji agwọ ndị nwere COVID-19 ihe ha na-eme ha bịa n'ụlọ ọgwụ anyị lete ahụ ha hụ na ha na-eku ume till ahụ ha esi n'onwe ha gbado ume ha dịkwa mma so ha na-eme anụnụ ga-ahụ na ahapụla 20 people now apụọla n'ụlọ ọgwụ anyị na-eji nwayọọ agwọ ndị nke ọzọ ha na-alakwa sọsọ mmadụ abụọ nwụrụ ndị niile nwere ọrịa so onye ọbụla na-agbalị ka ha hụ na agwọtara ndị nwere ọrịa daalụ nụ.
Yes, there was a question on the on measures that we're putting in place to spread that could be to stop the spread of infected persons who conceivably could be evacuated to Nigeria. Now, in the event that there are evacuations of Nigerians from foreign countries back into Nigeria, we of course have to prepare for them with places of isolation for 14 days, and they will be monitored, every single day for fever and other symptoms, and then they might need to be tested if, of course, they show symptoms. So the measures will be very, very clear. And then, regarding the foreigners who are leaving, whether there's something they know that we don't know. No, I think it's a lot more innocent than that. It's basically a case where people are more familiar with the health systems in their various countries, and so prefer to go to their countries so that in the event that they might have to be confined, they will be in more familiar surroundings, and they will also have access to the medical practitioners that they are used to, and of course facilities that they are used to. So that's really the reason. And besides, a large number are staying on. Those countries that have evacuated citizens, you'll find that their heads of missions and ambassadors and other staff are still here in Nigeria and have no plans of leaving. Thank you.
Honorable Minister of Humanitarian Affairs, Disaster Management and Social Development.
Shugaban wannan kwamiti, 'yan uwana ministoci, 'yan jarida, barka da rana. Tambayar da aka yi akan mutane wanda ake ba wannan tallafi in sun rasa rayukansu, menene matakin da aka ɗauka. Kamar yadda kuka sani, wannan tallafi ga gidajen ne, ba ga mutum ɗaya ba ne. So in ma mutum ɗaya ya rasu a cikin wannan lokaci, akwai sauran iyalan da suke gidan, kuma dama ana amfani da shugabannin al'umma ne da angoyi a fitar da waɗannan mutane wanda suka cancanci a basu wannan tallafi. Saboda haka tallafin zai ci gaba, za a ci gaba da ba a waɗannan gidaje. Kuma ko da tambaya ta biyu shine wannan abin da muka fara ana ba waɗanda wannan dakatarwa ko wanda dakatarwa gida din ya shafa, a'a, yanzu muna yin waɗanda dama suna cikin rajista ne, kuma duka a faɗin ƙasar nan ne. Kamar yadda muka yi bayani a baya, mun fara ɗaukar matakai na a ci gaba a yi sabuwar rajista na ɗaukar waɗannan mutane yanzu da wannan covid-19 zai iya shafa, ta hanyar yadda za su iya ciyar da kansu da sauran al'umuran rayuwa. Na gode.
Honorable Minister of Information and Culture.
Thank you very much. I think I'll first make my explanation in English, then I'll do it in Yoruba. Actually, what the gentleman asked was whether our advocacy campaign, our sensitization, whether it's getting to the grassroots or not, and what is going to happen when somebody who has tested positive or with the symptoms escapes from the town to the village. How do we sensitize the people in the village about it, about the pandemic? I think when I made my report on Wednesday, I did explain that efforts are being made to ensure that we reach the grassroots. And I did say that the option of tank criers in the normal and traditional sense might not work now, because generally tank criers will attract many people, and that would defeat the purpose of social distancing. But that we're actually working on how this message will still penetrate to the grassroots without, jeopardizing the health of those who are receiving the information. To this end, we are seeking collaboration with the traditional rulers, with the faith leaders, and we are using effectively the NOA, which is the National Orientation Agency, who are working in close collaboration also with the environmental sanitation officers in every local government of the Federation. We are going to ramp up our collaboration, and as a matter of fact, I have a meeting this evening with the heads of NOA, the NTA, FRCN, and NAN to see how we can further develop this message so that it will get to everybody. But I want to assure you that there's hardly any part of Nigeria today not aware of coronavirus or not aware of our sensitization and advocacy program, but it's never enough. So we continue to deepen our penetration, into grassroots. Eshegon, nti ebere ni wípé ṣé gbogbo ètò tá à ń ṣe, gbogbo ìkéde tá à ń ṣe, ǹjẹ́ ó dé ọ̀dọ̀ àwọn èèyàn wa tó wà nílé? Tẹ́ bá rántí ń jẹ́ ìta tó wá síbí, mo ṣàlàyé pé àti wọ́n ní tí iná ò bá ti tán láṣọ wọ́n ní ẹ̀jẹ̀ ìtàn lè kan náà sọ wípé àti sọ wípé a ti débi tá à ń lọ ṣùgbọ́n gbogbo ọgbọ́n tí ó bá gbà a gbọ́dọ̀ mọ̀ wípé a gbọ́dọ̀ jẹ́ kí àwọn ará ilé wa tán wà lábúlé tán wà lóko kí wọ́n mọ̀ nípa kòró tí ń bá gbogbo ayé yìí jà ṣùgbọ́n ẹ má jà tanra wa kò sí ibi tí wọn ò ti gbọ́ ń pa kòró kódà ní abúlé wa wọ́n mọ̀ ń pa kòró kódà wọ́n ti kì í ẹni tó bá gbọ́ yóò bá ní transfer oríkì kòró fún yín yẹn jásí wípé akitiyan wa àti gbogbo atónu tá à ń ṣe ní gba ọ̀rọ̀ kòró yìí pé ó délé ó sì dóko ṣùgbọ́n a ti mọ̀ wípé ọ̀rọ̀ tó wà nílẹ̀ yìí kì í ṣe ọ̀rọ̀ ọjọ́ kan a ti wá rọ àwọn lọ́balọ́ba àwọn olóyè àwọn àlùfáà àjọ àwọn lèmọ́mù gbogbo wọn pé kí wọ́n bá wa dá sí ọ̀rọ̀ yìí ńgbà ṣe rí níta ń gbọ́ ni pé àwọn èèyàn wa ń gbà míì ó máa sọ pé kòró yìí o kì í ṣe àrùn tálíkà o àrùn olówó ni o àrùn gbajúmọ̀ ni o àrùn gbogbo wa ni o ẹ má dá wọn lóhùn o kò sẹ́ tí kòró lè mú o ṣùgbọ́n tí a bá ti bá a ṣe lọ lójoojúmọ́ a máa fi tó yín létí ètò tá à ń ṣe ẹ ṣe púpọ̀.
The beneficiaries of the conditional cash transfer, what if in the event that the person dies? And I said this intervention is on households. So even if the person that is identified to be representing the household happens to die, other members of the family will benefit. And that the other aspect of it is whether the intervention really is for the people that are affected by these restrictions. And I said, no, this is an ongoing process. We have been doing it, and we are now looking at ways. We have started making preparations for the rapid expansion of the register to include these other vulnerable groups that are being affected by these restrictions. Thank you.
Thank you. Now we will have the SGF, who is also the chairman of the PTF.
The first question is with regards to global food crisis. I think we are taking steps to address that. Even some of the measures you had me announce yesterday had to deal with fertilizer companies and also trucks that are moving fertilizer all across the country, where I spoke specifically that we were exempting the movement of farm produce and other associated products that would enhance our agricultural activities. We have recorded a major level of success in our agricultural productions in the last couple of years. The first thing the president will tell you that God was faithful in providing very good rainy seasons, and also farm implements and products like fertilizer and the rest were made available to our farmers. That we were, with the closure of our borders, we came to the conscious realization that we had attained some level of food sufficiency, particularly with the support of the central bank in the area of growing rice and other components in our agricultural system. I think we are prepared, but you never get over-prepared when it comes to the issues of food stock. I am glad to also inform you that after Mr. President approved that we take out 70,000 tons of grains for distribution as part of the palliatives for this particular surge. I can reliably inform you, before I came to this press conference, I was with the Minister of Agriculture. He has, in the same vein, approved that we restock with 100,000 tons. So as we are depleting our stock, we are also restocking to make sure that we prepare adequately in case there are going to be challenges. The second question has to deal with the issues of FCT bubbling with people around because of the window that has been created by the PTF. I don't think we created any window. As a matter of fact, what we did was to tighten the process. And yesterday, I was very, very clear in my announcement that after the national coordinator read out the protocol, I said, markets that have been closed by the governments of Ogun, Lagos, and the administration in the FCT remain closed. The consideration we gave for markets to operate not on daily basis, within a limited time, has to deal with even the satellite markets, the neighborhood markets that have been created. We are saying that they don't have to function every day. They can function every other day within a limited period of time. But we have to also understand the psychology of what is happening. You are media people. You are experts in this. You know what is happening. Somebody will go into the internet and pick up something that happened in 2012 and post and say that it is just happening in Warri or it is just happening in Lagos. And we have to be very careful here so that we do not tie the hands of our law enforcement agencies and incapacitate them from being efficient and effective in the implementation of this lockdown. Yesterday, I was watching CNN. A woman in Chile ran out of isolation center. The police ran after her and grabbed her and pulled her back into the isolation center. In a lot of countries, with countries like Russia and the rest, you can't talk about the punitive processes that have been put in place. You decide to disregard the regulations that have been put in place. There's a quiet place that has been prepared for you in jail for certain numbers of years. I have emphasized the fact that what we are trying to do is to have Nigerians on this process. It's for our good to protect ourselves and to protect our loved ones. And we must push this narrative out there so that we take ownership of the process. In my speech today, I recounted to you what the president said. He said that on no account should any Nigerian suffer any pain or loss as a result of this lockdown. So with the compassionate heart of a father, the president desires that we take ownership of this to create the atmosphere that will enable the law enforcement agencies to work with us, to secure our people, to secure the health and the wealth of our nation. I think we've gotten to a point where we must truly be open about some of these things. You watch the news, you see in London, a temporary mortuary is being prepared. Not one, not two. What else do you want to know that this is a serious issue? That as a people, we must be conscious of that, and we must awake from our slumber and deal with this thing decisively and cooperate with government, cooperate with all those that have responsibilities of ensuring that we take the necessary steps. Or do we want to wait until we are confronted with those kind of situations? COVID-19 is not an ordinary virus. it has overtaken the world with a storm, whether you want to believe it or not. It has overrun even the best of medical facilities. You know it as good as I do. Our medical infrastructure is nowhere compared to the nations that are being driven aground as a result of this pandemic. And we still are casual about this. So it is your responsibility as the media people to drive a narrative that will cause every Nigerian to own this process and be deliberate and committed to ensuring that we protect ourselves first before we protect others and our loved ones. So I think, honestly, we have to do all we can not to tie the hands of the law enforcement agencies and incapacitate them in enforcement and efficient conduct of this process. There was the issue of isolation in the wards in Gwagwalada that people leave whenever they hear about a patient, a COVID-19 patient being brought. This is all part of our responsibility collectively to educate our people, that we do not even have to stigmatize anybody that is afflicted with this particular virus. It's a thing that has come. It's not homegrown. It was imported into this nation, and we are dealing with something that has overtaken the entire world. As of yesterday, I think there are about 204 countries of the world, if I stand to be corrected by the representative of the WHO. 204 nations of the world are battling with this. Some are recording deaths in thousands as of their statistics this day. We have, by the grace of God, our fatality is still 2. If we work together, we can keep it as low as we can. But if we decide to work at cross purposes, let us just look at the picture of what is happening in Europe. If we think it cannot happen here, then we are deceiving ourselves. So we need to arise and need to work as a people to ensure that we have something going for us as a nation. Let's prove the world wrong on this, because the expectations is that we will crush under this. Major networks of the world are carrying such news items that Nigeria is definitely going to crush under this. But I know the Nigerian resilience and the Nigerian spirit would overcome this, like we overcome the other epidemics in the past. To akan wannan jawabi na batun mutane suna gudun duk wanda ya kamu da wannan cuta, musamman a asibitin na Gwagwalada, ina so in gaya wa jama'a akan cewa an keɓe ward guda ɗaya a wannan asibiti inda za a kai waɗannan mutanen da suka kamu da wannan cutan. Wannan kuma ba cuta bane wanda ya kamata mu zargi mutane da shi. Ba cuta bane wanda asalinsa a wannan kasan. Daga Turai ya zo. A yanzu da muke magana ɗin nan kusan kasashe 204 na sashen duniya sun kamu da wannan cutan. Ba cutan Najeriya bane. Kun tabbatar akan cewa an kawo mana ne, amma ya kamata kuma mu tashi haikan a matsayinmu na 'yan ƙasa, mu ɗaura ɗamara, mu tabbatar mun yi yaki da wannan cutan, mu samu nasara kuma akan sa, kamar yadda muka samu nasara akan waɗansu cututtuka wanda suka shigo wannan ƙasan wanda ba mu muka kikkira su ba. Na gode.
Thank you very much, SGF. With that response, we have come to the end of today's national briefing. But before we close, let's take a few announcements. The next briefing will be on Monday at 2 p.m. But the ministers will be available to engage with various media houses on programs. So you can reach out to any of the ministers of interest to you. We want to thank all our partners, all the stations that have been transmitting live, and all the stations that have been taking this to our various homes in different Nigerian languages, as well as in French and English. We wish you a very pleasant weekend, and we pray that by the time we brief you on Monday, we'll bring you good news. I thank you very much.